Well, we would never be satisfied that everything has been done, and we'll always strive for more. But the outcome of the report laid out certain aspects that we are confident have been tackled. In fact, there's just one aspect which we want to improve upon, which is the recommendation that we should have a vehicle to be able to transfer patients to outings and for specific purposes.
Other than for this bus issue, do you believe mental health services to be running with adequate staffing without any major issue?
Well, things have improved. What we are looking at, a report that was written by the Mental Health Board back in 2019, okay, and it was the unfortunate part of this is that it's taken a while to actually have this paper laid out in Parliament. So we are about to publish a follow-up report, which is that of 2020, which actually will show and demonstrate that the recommendations made by the Mental Health Board have been corrected since.
As you mentioned, the second annual inspection took place in February. Presumably the second report by the board was completed and submitted. Have we a time frame in which we can expect this to be publicly accessible?
Well, it shouldn't take too long. I have just received a copy of the report, so I need to read that, and that will be laid in Parliament pretty soon. What won't happen is it won't take as long as the first report took.
So, I mean, generally speaking, then you expect the news report to reflect that these improvements have been made and the recommendations have been acted upon. In the statement, you've mentioned that all recommendations have been acted upon, but there seems to be no mention of a few specific issues which were detailed in the report. One of the numbers that really stood out was, 3 registered mental nurses and 6 other nurses for the Coaling Island facility. That's really a ratio that you think can provide high quality service?
Well, what we need to see is the improvement. I mean, where we've come from and where we're going. So there's always, as I said, room for improvement. We need to fully assess, and I think it's up to the professionals to know exactly what our needs are and whether we are hitting those targets. But something which really we should be asking the professionals that work there for their opinion in that respect.
Obviously, the professionals have some input, but I think the service users and their impression of the service is valid as well. I know that it's difficult, anecdotally speaking, it's very difficult at times to be seen by the professionals there. Do you think that there is a reasonable waiting time, for example, to be seen by a psychiatrist or a psychologist?
We now have an increase in complement, so we have a psychiatrist that works from there, and very much depends if it's a referral specifically for mental conditions, or whether it's a referral for medical issues. So we now also have input from 2 doctors who are consultants. One of them is a consultant within a psychiatric consultant, and the other is a more general consultant. So very much depending on what the ailments are, what the conditions are.
You bring me to my next question there, the mention of the audits, which is a public health audit, rather mental health audit, took place last year. The Mental Welfare Society has called for its publication on various occasions. Is there any reason why it has not yet been published?
That document will be published. As I said, it's been caught up between the fact that the reshuffle, the elections took place. Then we had COVID, which has taken most of our time. So the reality is that it just hasn't been something which has happened, but it does need to happen. I mean, these audits are very, very important because first and foremost, we have the local authority, the local mental health board that looks at the way we function. And over and above that, this report that you're alluding to is one which was commissioned by it was in fact the Minister for Health then, with the Director for Public Health then, and this was an external audit carried out by Public Health England, who came back with a lot of suggestions. They were very positive in their replies, in their outcomes, but as all reports go, there's some good things and the things that need to be tackled.